we have the internal female genitalia, then we have the accessory glands. So these glands, sometimes we include them under the external, sometimes under the internal. So we'll start with the female external genitalia or female external genital organs. From the word external, these are the parts of the female reproductive tract that you can see visibly on looking. When you ask the woman to lie in lithotomy position, on her back, these are the parts that you can see visibly. They are outside, they are external. So this include, or the general name for it is the vulva. The female external genitalia is also known as the vulva. So it includes the mons pubis, also known as mons veneris. This is the area that is on top, closer to the abdomen, and is the part that contains hair, or that has hair. Then we have the labia majora. When you say labia, it means lips. Majora, the bigger lips. Then we have the labia minora. Then we have the clitoris. The clitoris is like a knob. We're going to see the image. The clitoris is like a knob that it's a bundle of nerve fibers with very rich blood supply. And it is the only organ. This is a potential OBG question you can see. Dash is the only organ that its only function is for sexual pleasure. And the answer is the clitoris. Its main function is for sexual pleasure. Then we have the vestibule. The vestibule is an oval space that is enclosed by the two labia minora, and it contains the clitoris, the urethral opening, and the vaginal opening. We're going to see the image. Then we have the greater vestibular glands. These are also known as Bartholin's glands. Then we have the bulb of the vestibule. You're going to see the diagram. Good. So this is the diagram. So you can see the mons veneris, which is the first one, and that is also known as mons pubis. I told you this is the superior aspect of the female external genitalia, or of the vulva, and underneath it we have the symphysis pubis, and it is hair containing. This is followed by the labia majora. You can see from the image. We're going to take each one and discuss. So let's start with the mons pubis. It is a rounded pad of fat lying anterior, that is anterior to the symphysis pubis. I told you underneath the mons pubis is the symphysis pubis. It is covered by pubic hair from puberty. So you can see it here, the mons veneris or mons pubis. Then we have the labia majora, or bigger lips or greater lips. These are two folds of fat and areolar tissue covered with skin and pubic hair on the outer surface, but inner they have smooth inner lining. So internally they don't have hair, but externally it is also covered by pubic hair. When you look at the picture, back to the picture, you can see the labia majoris. Okay. Then we move to the labia minora. Labia minora is the smaller lips or the lesser lips. They are two small subcutaneous folds devoid of fat. These are potential OBG questions. Dash are two folds of fat. The moment you hear folds of fat, we're talking about majora. When we say devoid of fat, they are still folds, but devoid of fat, and also devoid of hair. So these are the two things you can distinguish between labia majora and minora. So this labia minora, like I told you, they are two small cutaneous folds that are devoid of fat and hair that lies between the two labia majora. So anteriorly, that is upwards, this labia minora divides into two. The upper part, when it divides into two, one part goes above the clitoris, another part goes below the clitoris. So the upper layer forms a fold over the clitoris, while the lower layer goes below the clitoris. You can see from this image here, this is the clitoris at the center. I wish I had a pointer. I will see about that next class. So the upper part that goes above the clitoris is called the prepuce, and the part that goes below the clitoris is called the frenulum. So that is the labia minora. Then when you come down posteriorly, we've talking about anteriorly, posteriorly, the two labia minora join together to form what we call the fourchette. Okay, I will draw just to make you understand better. So what we have here is, you can see, we have an oval, and here we have another. I hope you can see. So this is our labia majora. Good. So within this labia majora, we have another, you can see, lips. And when you look at it anteriorly, this labia minora now, when it comes anteriorly, it divides into two. The same thing with that of the other side. When it comes anteriorly, it divides into two. And between them here, we have the clitoris. So this part that divides, that goes on top, is what we call the prepuce. This is similar to the prepuce in males, which is removed during circumcision. So this is the hood that goes above. Then we have another part that goes below. You can see all this is part of the labia minora, and this one is called the frenulum. It means like a tongue also. This is anteriorly, that is upwards. So when you come down now posteriorly, the labia minora again comes together at this point to form what we call the fourchette. I hope it's visible. Good. To form the fourchette. And this fourchette is that point when you're giving your episiotomy. This is the point where you put your episiotomy scissors first. If you're doing the midline, the mediolateral, you go in down a little, then you turn laterally. That is the fourchette. Okay, so the next is the clitoris. I've already shown you from the diagram I drew. The clitoris is a small rudimentary sexual organ, and it corresponds to the male penis. You know that from up to 10 weeks of gestation, you cannot differentiate between a male and a female fetus. The reason is because at that point they are the same, but after around 12 weeks, they begin to differentiate. And the rudimentary form of the male penis is the clitoris, and it is a sexual organ. So it is a knob-like portion located near the anterior junction of the labia minora. It is above the opening of the urethra and vagina. Sometimes it is said to be above the opening of the urethra and the vagina. The clitoris does not contain distal portion of the urethra. This is just the difference between it and the penis. Then we have the vestibule. The vestibule is that oval area, like we mentioned, that lies between the labia minora. So I'm going to go back to my drawing. Good. So this round area here, this is the vestibule. So what is within this vestibule? We have our labia minora. What is within this vestibule? The first thing is the clitoris. Then just below the clitoris, we have what we call the urethral opening. Urethral opening. This is the opening that leads to the urethra, to the bladder where urine comes out. Then 2.5 centimeters below this, we have the vaginal opening. So this is usually depicted this way. So here we have the vaginal opening. So this is the vestibule, this oval area that is within the labia minora. So then we have the urethral orifice. This lies 2.5 centimeters posterior to the clitoris, or below the clitoris. On either side of this urethral orifice is the gland I was telling you about, accessory gland. This is known as the Skin's gland or Skin's ducts. So these are found on either side. You can see them here on either side of the urethral opening. Next is the vaginal orifice. This is also known as intriotus. Please, I want you, in that notebook that you have, the diagram, as I'm drawing any diagram, please be attempting. I want you to write intriotus and underline. I've seen a lot of questions. I've seen it previously. OBG question. The vaginal orifice is also known as dash. It is also known as intriotus. It occupies the posterior 2/3 of the vestibule. The orifice is partially closed by the hymen. This is prior to initiation of coitus. But after that, the hymen gets torn with intercourse, and what is remaining is called carunculae myrtiformes. Carunculae myrtiformes, this is the remaining tags of hymen after intercourse. This is also a potential OBG question. Then we have the greater vestibular glands, more commonly known as the Bartholin's gland. These are two small glands that open on either side of the vaginal orifice. On either side of the vaginal orifice. What is their function? They secrete mucus, which serves as lubrication for the vaginal opening. So the duct may occasionally become blocked, resulting in a cyst. Then we have the bulbs of the vestibules, which are elongated erectile masses flanking the vaginal orifice. So they are also surrounded around the vaginal orifice. So what is the blood supply? For this, just remember pudendal. Pudendal arteries, pudendal veins, and pudendal nerves. That is going to be very easy to remember. So for the arteries, blood supply, we have internal and external pudendal arteries. For the venous drainage, we have internal and external pudendal veins. For the lymphatic drainage, we have inguinal glands. Then for innervation, we have branches of the pudendal nerve. So this is going to be the first lecture, or the first aspect we'll be covering. I'll be posting some questions for you to attempt and answer. If you have any question, we are going to have a discussion later on WhatsApp. So thank you very much. Have a nice day.